This web-based training will help to clarify the use of SCM for users in a research role. Please complete the SCM view only with document entry WBT before attempting this course, as it will provide a foundation for the functionality of SCM. To begin, we will create a personal list. These lists are very useful to researchers since a patient on a personal list will remain on that list until the user removes them. Begin by clicking on the Find Patient icon. Use this icon, rather than Find Visit, because it will allow you to see all of the patient's visits, regardless of visit status. Enter your search criteria in the appropriate fields, then click the Search button. Any patients matching your search criteria will appear in the box below. Remember, if you search for a patient by name, make sure you confirm the patient's identity using birth date or medical record number. Click on your patient to highlight them, and then click Show Visits. Select the visit or visits you want to add to your patient list by left-clicking on them, then click the Save to List button. If you are creating a new list, you will need to give it a name. A personal list can be named almost anything you want. In practice, it is best to give the list a name that is relevant to the list's purpose and not insulting to a patient or their family. You may save your patient to an already created list by selecting the Add Patient to Selected List radio dial, then left-clicking on your desired list to highlight it. Click OK to complete list creation or patient addition. We will need to add a banner to the patient header to designate that the patient is participating in a study. Begin by making sure the patient is in context, meaning that their information is displayed in the patient header, then click on the Patient Info tab. Under the Patient Info tab, locate the comment link in the data entry section and double-click it. Choose the type of comment you want to add. In this case, we will select Research. You will also need to fill out the comment box with the study title, principal investigator, the study's coordinator, and a contact phone number. Once you have filled in this information, click OK. Click the Refresh button and the research participant banner should populate on the patient header. You may need to enter orders for your patient. Click on the order entry icon located in the patient header. In some cases, there will be an additional order entry icon in the main toolbar, but it is a UK healthcare best practice that you use the option in the patient header. The Requested by box allows you to enter orders on behalf of yourself or a provider. A current provider is any physician who has entered at least one order for the patient. If the provider you need is not listed under current providers, click on the radio dial next to Other. When searching for a specific provider, only use last name. Type the name in the appropriate field, then wait for SCM to populate the results. Left-click on your selected provider and their full name will populate in the search box. You will next need to choose the source of the orders. In most cases, research staff will enter their orders, per protocol. Once the source has been selected, click OK to proceed to the order entry screen. Before you enter any orders, you will need to confirm that the order type is appropriate for your needs. Most research staff will find their orders default to Hold for Release, meaning the order will not immediately activate upon entry. For orders that need to be completed immediately, change the order type to Standard. There are several different ways to search for orders. If you are looking for a single, specific order, the best method is to type the order name in the designated field. When searching for orders in SCM, it is best to use broad terms. In this case, to find a CBC with diff order, search for CBC, select the desired order, and click Add. When entering orders, you will be required to fill out any fields with a red star in them. You may complete the other fields if you choose, but they are not required. Once you have filled out the necessary fields, click OK. You will return to the order entry worksheet. The order you selected will appear in the holding pen at the bottom of the screen. Until the order is submitted, it may be modified or deleted if necessary. Once an order is submitted, changes can only be made by discontinuing and reordering it. In research positions, you will often use order sets, which allow you to enter multiple related orders at the same time. You can save the sets you use most by first selecting the desired set, then clicking the Add to Favorites button. The order is now located under My Favorite Sets, which can be reached from the drop-down menu on the left. When you have completed entering all of the orders, click on the Submit Orders button on the bottom right of the screen. Complete the process by entering your password when prompted, then click OK. To check the orders you have entered, click on the Orders tab and change the From Date to Today. If your order was entered in Hold for Release status, you will notice a red circle with a line through it beneath the order's name. Research staff are also responsible for entering and updating documents throughout the patient's time in the study. To begin a new document, click on the Enter Document icon in the main toolbar. Type the name of the document you need into the search box, left-click on the desired result, and then select Open. Once the note loads, you will have the option to add a co-signer by clicking on the Document Info tab to the left. Place a check mark in the co-signer box, then use the search window that appears to locate your desired co-signer. You may add up to 2 co-signers per document. To enter text in your note, left-click on the field you wish to chart in. To navigate more easily around a document, click on the Sections tab to the left. Clicking on the document section names under the tab will instantly transport you to the corresponding section of the note. When you have completed filling out all of the necessary information, click the Save button. Type in your password, then click OK to complete the save. If you wish to view your document or make edits to it, you may do so by clicking on the Documents tab. Locate your document, then click the Preview icon from the tab toolbar to view the note in a reading pane. Notice that the document's signature status is also listed. Documents that are complete and signed will have the signature status of Signed in Full. You may also double-click on the document's name to bring up the note in a separate window, from which you will be able to print the document or make modifications. If another user is modifying the document, you will receive a warning message that the document is locked. You may still be able to look at the note in view-only format, but you will not be able to make any changes until the other user's work is saved. There are other places in SCM where useful information may be viewed. UConnect, which serves as a bridge between SCM and AEHR, allows you to see information from your patient's ambulatory visits. Click on the UConnect tab to view notes, medications, and other encounter information from the UK healthcare clinics who use AEHR. The SRM tab contains scanned documents from outside hospitals that you can view or print for the participant's shadow chart. Documents within the chart can be accessed by clicking on the desired date under Results, then selecting the desired entry from the document list below. This concludes the web-based training. Please contact the IT service desk with any questions at 3238586.